Good morning, everyone. I'm Mark Sussman, the editor of Willamette Week. Thrilled to be here with Laurel Berge. Did I get that right?
Berge.
Berge, who is an ER physician at Kaiser, who's doing some really fascinating stuff. Laurel, let's just first start talking about sort of your personal life. I mean, you're going to work every day, but you are sheltering in place. You live in Hood River, did you say?
I live in Hood River and commute into work into Portland. Yes.
And when you're not working, you're sheltering in place and keeping yourself safe?
Yes, I am. Brought my son down actually from Seattle when the epicenter started there. And his friend and they have been instrumental in helping me stand up this operation. But yes, sheltering in place looks a little bit different when you start a company as well.
So your day job is you're an ER physician at Kaiser, and I don't know what sort of hours or shifts you work. I assume it's not necessarily 9 to 5.
Absolutely not 9 to 5. In fact, the shift I work today is 3 p.m. to midnight, and we'll often finish at about 2 a.m. in the morning and then come back home.
And Kaiser Sunnyside does have some COVID patients currently?
We sure do. Yep. Both West Side and Sunnyside.
Gotcha. And has Kaiser cleared out a number of either its floors or its beds in preparation?
Kaiser's response, like all the other partners in the city, have done an outstanding job of determining isolated COVID units, both in the emergency department as well as in the hospital.
So you, in your capacity as an ER physician, are seeing patients who have COVID, but they don't know it until they walk in. Is that correct?
Correct.
So they're coming
Correct.
for some other reason. They broke a leg or whatever, and they show symptoms, and then you test them?
Yeah, it's not even so much that they're showing symptoms. It's something will kind of stand up on the back of your neck to say, to run the test. And we are lucky enough now that the test is in-house and we can turn it around in 2 hours. When we first started doing this testing, like a lot of states, it was taking 3, sometimes 4 days. And we have to really carefully triage. We have very specific triage protocol of who gets the test and who does not. Because we have a limited number of tests. But yes, some people are a complete surprise. Most people, you have a feeling.
So you get people that are walking in or to getting an ambulance to the emergency room, either they're showing symptoms or not, but for whatever reason you test them and you learn that in addition to wherever they came, they've got COVID.
Correct.
You then shuffle them off to some COVID isolation area of Kaiser. But meanwhile, you're the attending physician. You obviously were closer than 6 feet to them. What do you do?
Well,
you drink a bunch of bleach, or what do you do?
we have had excellent leadership. Actually, we very early on when this came on. So in January, long before Oregon even started its response, we were having emergency meetings between our staff of how we position the bed in the room to make sure that you could still stand 6 feet from a patient, that each patient, you should actually wear gloves. Each patient, you should have a mask on at the very least. And then if you had a really high suspicion, you would gown up. And then, of course, if you were doing a very invasive procedure like an intubation where we put a breathing tube down someone's throat to breathe for them, you were in a full PAPR. We have to be careful with those supplies because they are extremely limited. And so it is a moral and ethical decision that you face every day as an ER physician, which has been psychologically tolling.
So can you, seriously, just talk about that a little bit. I would just assume, like, what's it like when you come home at night? Do you feel like you've got to strip down and leave all your clothes outside?
In fact, we do exactly that. Each one of us has come up with their own protocol, but it's pretty standard. We have 2 garbage bags hung up on the wall. You actually stand outside in your garage. You completely strip. You wipe everything down, your glasses. We have stopped wearing jewelry. We wipe down our phones, which we've kept in Ziploc bags the entire shift. We leave our shoes out at the door. And then we immediately have a very specific path to the bathroom where we take a shower. And then the clothes that we wore are actually put into a garbage bag and then washed in a sanitary cycle. And that was an organic thing that all of us came together. But to answer your first part of your question, I think probably the worst part of this is to kind of feel like a walking time bomb. You know that you accept some risk as a physician to work. We're always at risk in the emergency department from violence from patients, from sick patients, from being sued. I mean, all of this is filtered down, but this becomes a little bit more real. 51 of us now are COVID-19 positive throughout the institute.
50, what do you mean?
51 physicians, nurses, techs, pharmacy techs.
In the state?
Yeah. No, actually throughout Kaiser system. Yeah. So it's real. We get infected as well.
Laurel, have you been tested?
I have not been tested. Thankfully, I am actually asymptomatic and do not have symptoms.
But it doesn't mean you don't have it.
Yeah. I mean, right. I am asymptomatic. I do not have a sore throat, a cough, a headache, a fever.
Again, just in terms of the protocol, if you wanted to get a test and you were asymptomatic, you're a doctor, you're on the front lines, could you get a test?
If we are symptomatic, we absolutely can get a test.
No,
and in fact,
if you have no fever and you're completely asymptomatic, but you just had a hunch.
It's really, we have to save tests for the people who absolutely need it. And we take 100% precaution at home and at work to make sure that we, even if asymptomatic, wouldn't spread it. But no, I would not go as an asymptomatic doctor and demand a test or even ask for a test.
And yet, every time you cough, you got to wonder, right?
It is not just me, but every single person who has developed allergy-like symptoms thinks for a spare second, this could be it. I could have it. Yes.
Laura, let's shift a little bit because one of the reasons we're interested in talking to you is because while you've trained as a physician, you have in the last few months become a bit of a nonprofit entrepreneur. You recognized a shortage of hospital protective equipment and decided to take the bull by the horns and do it yourself. Can you just sort of give us a short summary of how this came about?
Sure. To be exact, we're on our 37th day, so not even months. It started, which has kind of become a familiar story, but is true, at 2:30 in the morning after I got home from my first shift treating my first patient, where we had kind of been asked, like every other place in the country, to conserve personal protective equipment because we were running out or just plain out. Decided that there had to be a better way. I didn't know what that better way was, but I have the distinct blessing of having a friend, Maui Meyer, who is not only a local businessman, but has extensive over 30 years of grassroots connections and business acumen. And so at 2:30 in the morning, I came up with the first prototype and then called him at about 7:30 in the morning. And after about 4 hours, we had our first kind of conversation with the first person. It ended up being, from the very beginning, actually multifaceted. Not only did I want to actually make personal protective equipment in a better way, but I wanted to, I saw all of our local garment factories closing down, laying off workers. And then I wanted to make sure that it was a replicatable process, so that whatever prototype we came up with could be given in a free and non-patented, non-copyrighted way to any other state that wanted to follow us. And, you know, there's only a certain amount. I mean, it's thought that there will be a need for 13 million gowns in 3 months just in the Pacific Northwest. Obviously, our small entrepreneurial effort cannot match that number. So you have to make this process replicatable if you can.
And these are gowns that are worn by physicians and nurses who are working with COVID patients?
Yes.
What is it about these gowns that are so special? Because as I understand it, and you're going to explain this, it took some work for you to get the kind of material that these
Yes.
gowns are made out of that is more effective than other material, I guess.
Yes. So, um, gowns, in order to be isolation gowns. So there's a difference. An isolation gown is to protect the wearer, the physician, the nurse, the tech, the frontline worker. It's to protect the wearer. Surgical gowns are to protect the patient from us giving the patient something. So in mass disaster protocol and infectious disease protocol, isolation gowns are required. So isolation gown has to cover from your neck all the way down to past your knee. It has to come all the way down past your wrist. It has to be tied in a particular way. It's highly specialized. Donning, that's how you put it on, and doffing, how you take it off. It takes specialized training to even how to do it. So hence the frontline workers. We are trained extensively in how to don and doff. And so that was the goal. And as far as the material, medical grade fabric is locked down because it's patented, copyrighted, and it's given to big industries, right? Who, even though that might be American industries, they take this fabric, they ship it to China, Vietnam, South Korea, they manufacture the gowns, and then they ship them back to the United States. So we didn't have access to medical grade technology. We've been working on that nonstop. So we actually did research and chose a commonly found product in any home improvement store, which is a house wrap, which is air, water resistant, and will protect the worker.
Is there enough PPP equipment in this state for us to open up the healthcare system to elective procedures, which we're now doing?
It's a complicated question. I hope that I can answer it correctly. I can tell you that the governor and our leaders are in a very difficult spot, meaning don't open up soon enough. And people, elective procedures, by the way, was even treatment for some cancers. Elective was considered treatment even for some simple appendectomies, like to remove your appendix. Like elective procedures were whether or not you got your autoimmune injection for your multiple sclerosis. I mean, it is truly heartbreaking. So I believe that a staged opening is what we're going to have to do. And the governor and her task force, I know, are working tirelessly to try and get us the correct protective equipment, and have done so. The answer is yes and no. Do we have enough? Yes. Do we have enough? No. There is no right answer. You have to move forward together. And it is one of those ethical conundrums that this pandemic has brought on a daily basis, Mark.
But don't you think it is safe to assume that next week there are going to be healthcare workers working with patients who will not have the appropriate PPE?
It is safe to assume that. And probably one of the more sobering things about efforts like mine, or even people who are sewing masks from their home or three-dimensionally, making face shields, is we are out of it before we even start, and it's not enough even before we start. So yes, the answer is yes. We do not have enough.
Laurel,
the whole country doesn't have enough.
As a healthcare worker who, spent a lot of time and investment and money to become a doctor in this country as opposed to somewhere else, who I assume takes great pride in the quality of the healthcare and training, I'm just wondering, for those of us who aren't healthcare workers, the shortage of equipment, the shortage of ventilators and of PPE, to those of us who are lay people, is just shocking. And it just strikes us that all of a sudden we think we're living in a third world country. Is this news to people who do what you do? Or is this something that you've been aware of for a long time about our shortage of certain critical supplies in the case of public health crisis? Or is this as new as it is to us?
It is unfortunately not news to us. Those of us who have spent our lives, I've 20 years, not only in emergency medicine, but in and out of disaster preparedness. The best way to put this is our medicines come from overseas, not all of them, but our medicines come from overseas. Our personal protective equipment comes from overseas. US manufacturing for a long time has been crippled, 15 years and some 20 years, 50 years. And this highlights the real danger we're in as a country when we live in a global economy and that much is true, but we are even before this pandemic, we would intermittently run into shortages of medicines in the United States. We would run out of shortages of medicines in my own hospital through no fault of the hospital, but because they were not being manufactured. So it is not a surprise to us. It is, however, sobering, even to us.